Hello students, we are continuing our pathology series. Here we will look at the very important question which is asked in each and every university, which is on pulmonary tuberculosis, and to explain the morphology of primary and secondary pulmonary tuberculosis. See, I would like to put disclaimer because I think it is important. Firstly, we are doing it in English because this level of lecture is for those students who want to get top 10 ranks, who want to clear NEET PG. Okay, we are genuinely making it for them only. Also, when we do the video in English, you might have some difficulty in seeing my video once or twice, but if it gets into your head, you would have retention for a very long time. Okay, so now the disclaimer is over. Let's see what I've told you. For an every LAQ you have to write an introduction. So tuberculosis is a chronic granulomatous disease caused by Mycobacterium tuberculosis. In the lung, it appears as a primary pulmonary tuberculosis in unsensitized person. Okay, unsensitized means the person who has never had exposure to Mycobacterium, and secondary pulmonary tuberculosis due to reactivation or reinfection in a sensitized hole. So, what happens is when the person has again been exposed to mycobacterium, then what happens? We club it into secondary pulmonary tuberculosis, and if the infection is happening for the first time, we call it as primary tuberculosis. So, what is the morphology? Morphology is very important, and we study morphology in two ways. First, we have to write about the gross morphology. Gross morphology simply means when we observe it without the microscope, and second is microscopic morphology, which we are able to see under the microscope. So, gross morphology, there are few points. Please pay attention. They are slightly complicated. Primary lesion is called Ghon focus. Okay, what is Ghon focus? It is a small gray white area of consolidation with cesiation. Okay, where it happens in the subpleural region. Either will happen in the lower part of the upper lobe, okay, or upper part of the lower lobe. So here, this is slightly contradiction, but this would help you remember it. How does it spread? The primary pulmonary tuberculosis, it spreads through lymphatics, causes hilar lymph node involvement. Hilar lymph node is the hallmark which is only seen in primary pulmonary. Okay, so where there is lesion, that point will be called Ghon focus. You can remember we focus on small things. So now if we take Ghon focus and lymphadenitis along with hilar lymph node involvement, this all three form a primary complex which is also called Ghon complex. So in primary pulmonary tuberculosis, you would see there are 2 points. One is Ghon focus and one is Ghon complex. And Ghon complex already has Ghon focus. So don't get confused between the two. Here you have to remember that the healing occurs by fibrosis and calcification. Calcification why? Because the primary infection gets controlled by the body, and all the cesiation is removed and calcified. The cheese like structure is dissolved, and the body tries to make it normal again by fibrosis and calcification. Whereas in the case of microscopic morphology, you would find tubercles with central caseous necrosis are seen. Okay, in microscope morphology, you have to write very two important points are that in the surrounding you will find three cells. One is epithelioid cells, second Langhans giant cells, and a rim of lymphocytes is also seen. So LEL or LLE, make a mnemonic. In primary, you have to write epithelioid cells, Langhans giant cells, and lymphocytes. All three are seen. Even if you are not right, at least write these three. Okay, otherwise your answer would be highly incomplete. So in gross, there are 2 points. Explain Ghon focus, explain Ghon complex. Okay, that covers most of the area. And microscope, explain that there are epithelioid cells, Langhans giant cells, lymphocytes, and In primary pulmonary tuberculosis, healing occurs by fibrosis or calcification. Okay, I have included a diagram so that you are able to easily, if you look at the diagram, you'll see a higher lymph node, and this is the main thing which is involved in pulmonary tuberculosis. And at the upper lobe, you can see Ghon focus. Now moving on to morphology of secondary pulmonary tuberculosis. What you would find in the gross morphology, that lesion is usually in the apex of upper lobe where oxygen tension is high. In pulmonary primary pulmonary, the lesion can move a little bit, but it is in the secondary, the lesion is clearly found in the apex of upper lobe. Okay, now what you will find is, you will find fibrocaseous lesion with marked cessation is present. Don't get for it, I'll explain to you. What does the word is written? Fibrocaseous. It simply means there are two processes which is going on simultaneously. One is fibrosis, another is necrosis. So at one end, the tissues are dying, they're converting into cheese-like structures, and in other words, body is trying to heal by fibrosis. So a region is present where this process is continuously going on. Okay, now the cheese-like material may discharge into the bronchus and produce cavity. Also, the surrounding lung shows fibrosis and scarring. Okay, it may, the secondary pulmonary tuberculosis may spread occur within lung, pleura, or through blood. It can, because excess of seizous material, wherever it will go, it will cause infection. If it goes through lung, other lung, it will cause infection there. If it discharges into the pleura, there will be infection, and if it enters the blood, the infection will be spread to all the essential organs. Now, what is the microscopic morphology? There are well-formed granulomas with central caseous necrosis. Epithelioid cells, giant cells, and lymphocytes are present. So, in the microscopic morphology of secondary pulmonary TB, there are again these three cells are present: epithelioid, Langerhans giant cells, and lymphocytes. However, tissue destruction is much more marked than in primary tuberculosis. Also, fibrosis is prominent around the lesion. Now, you can easily see on the screen the diagram of secondary pulmonary tuberculosis. You will see there is a two ring-like structures. Outer one is the surrounding fibrosis. Okay, inner one, inside the fibrosis, there is all the necrosis is going on. Okay, so basically fibrosis is acting like a wall, like a border, which is containing all these things from spreading all over. What are the differences between primary and secondary tuberculosis? If this question comes on LQ, you write, if you, even if you exactly wrote memorize what is given on the screen and then write in your exam, no matter how hard the examiner is marking, you will get good marks. If you have time, write the difference between secondary and pulmonary tuberculosis. What is the main difference? The host in primary is an unsensitized person. He's being exposed to mycobacterium for the first time. Whereas in the case of secondary tuberculosis, the person has already been exposed who has become sensitized. The primary tuberculosis, there can be two sides: lower part of the upper lobe, upper part of the lower lobe. But in the case of secondary tuberculosis, it is always present at the apex of upper lobe. And why it is present? Because their oxygen tension is most high. The lesion in primary tuberculosis is Ghon focus and Ghon complex. Okay. In secondary tuberculosis, there is a fibrocaseous apical lesion. Fibrocaseous simply means that the fibrosis and necrosis are going on at the same place, in close to with one another. In the primary tuberculosis, there is a prominent hilar node involvement. But in the case of secondary tuberculosis, it can be, but it is not well marked. Cavitation generally doesn't happen in primary tuberculosis. Why? Because the body heals it and converts it. But in the case of secondary tuberculosis, cavitation is most common. Severity of primary tuberculosis is usually mild, and in the case of secondary tuberculosis, it is more destructive. Outcome: fibrosis and calcification are most common in the primary tuberculosis. But in the case of secondary tuberculosis, fibrosis is occurring, but also cavitation. Why? Because of cheese-like matter. And why? Because the spread of cheese-like matter is also going on. If it is going into the lungs, it will create problem there. If it is going into the pleura, it will create problems there. And if it is going into the blood, it will create problem there. So now I think this is a LAQ worthy material of any university you can find. Let's conclude our lecture. Primary pulmonary tuberculosis is characterized by Ghon complex with higher lymph node involvement, whereas secondary pulmonary tuberculosis commonly affects the apex and shows fibrocation lesion with cavitation. See you in the next topic. Thank you.